Stanmore Safeguarding Adults Board is a meeting where a number of key professionals come together to ensure that we are all working together effectively to safeguard adults who live in Sandwell who have what is described as needs for care and support. So that may mean that they have a physical impairment, a learning disability, or a mental health disorder, or a long-term physical health issue. So this group of people meets together in Sandwell. At the moment, every 6 weeks. We do this by asking people for what we call assurance. So asking colleagues and partners to tell us what's happening in care homes, hospitals, adult social care, the third sector. Tell us what the challenges are. Tell us what people are saying, and listen to what people who live in Sandwell are saying. We also use what we call data, information that is collected, that sometimes comes in number format, but we also want to hear about people's stories and their experience. The role of the Safeguarding Adults Board is to ensure that everybody works together. The law says that people have to work together to ensure that adults, as I've described, are better safeguarded, and that we ask key questions and do key pieces of work to ensure we have the evidence that tells us whether people are safeguarded or not. The annual report is our way, the board's way, of sharing that information.
Healthwatch are committed to working in partnership to ensure that the voice of the citizens of Sandwell are heard, and this will contribute to the board's priority of listening to the voice of the service user.
The CCG is committed to safeguarding and promoting the welfare of adults with care and support needs, as well as those experiencing or at risk of abuse or neglect. As a commissioning organisation, the CCG ensures that it employs staff working within services either commissioned or contracts, that they understand their role and responsibilities regarding safeguarding adults. Throughout 2020-21, the CCG has commissioned and provided safeguarding level 3 training for all primary care clinicians. A total of 161 staff have attended the adult safeguarding training, all of which has been very well received.
The Black Country Healthcare NHS Foundation Trust are an SSAB partner, and they're actively involved in the work of the board and the work of the subgroup
and are passionate about making safeguarding everybody's business. We've recently welcomed Natalie Solomon as a board partner and member, and she supports the agenda and participates in a range of safeguarding activity, ensuring that people with needs for care and support who live in Sandwell are safer as a consequence of that activity. Country Healthcare NHS Foundation Trust are committed to reviewing their services to make sure that patients and people who live in Sandwell have a good service that makes the best use of all resources and ensures that people are safe.
The Care Act 2014 outlines a statute duty for adult safeguarding reviews to be undertaken. This is the responsibility of the Adult Safeguarding Board, and it is flexible to what proportionate methodology is used when a person meets the criteria outlined in the Act. Between the period of 2020 and 2021, there have been a total of 7 safeguarding adult reviews referred to the protection subgroup. Out of the 7 referred, 1 has been published, 3 have authors commissioned, and 3 did not meet the criteria.
Lockdown. I struggled with the lockdown. Overnight, it meant no more visits to the town. There was isolation across the nation. The government guidelines in the beginning, I thought were fine. Hearing repeatedly, staying at home, I felt depressed and alone. Communication was the key, as many as would agree. I took the challenge to upskill. I did this with determination and free will. Through Zoom, I soon was connected with others from my living room, reaching out to some HG members online, opening up and talking felt fine. Going to keep engaged, looking forward to the next stage. I can't wait to meet up face to face, even though we won't be able to embrace.